Assalamu alaikum and welcome back to another episode of What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and I'm a board certified physician. My show, What's Up Doc, is a production of Muslim Network TV, the only Muslim focused network broadcasting in North America. You can stream our shows on our website at muslimnetwork.tv as well as on our YouTube page at youtube.com/Muslim Network TV. You can also watch our shows on Roku, Apple TV, Fire TV, and Galaxy 19. In today's episode, we're going to be talking about arthritis. It's a condition that affects millions around the world. However, a lot of people associate it with aging. And as you'll learn in today's episode, that's not always the case. Joining us in that conversation is Dr. Wajeeha Yousaf. Dr. Yousaf is board certified in rheumatology and internal medicine. She trained at Baylor College of Medicine, Houston, Texas, and graduated in 2014. She's been practicing in the Houston area ever since. Her mission is to provide long-term comprehensive care to patients with rheumatological diseases. She understands the needs for physicians to be a partner in sharing the management of chronic illnesses. Thank you for joining us today, Dr. Yousaf. How are you doing?
Assalamu alaikum. I am doing very well. Thank you for asking. How are you?
I'm good, thank you. Thank you again for joining us today to talk about such an important topic. As I said, this is something that affects millions of people around the world, not just in the United States. And when people think of arthritis, they automatically associate it with an older person's disease. And we'll talk a little bit more about that today. So as a rheumatologist, this is something that is your bread and butter. You're often seeing this. So let's start by defining, for those who may be confused about the definition, what is arthritis?
So Aalia, I think it's very, very important to understand what is arthritis. And that's a great question to begin with. Arthritis is basically any joint that's inflamed. Inflammation is defined as swelling, stiffness, redness of the joint. And there could be various different causes for that inflammation. So arthritis is basically any space between the joint that's inflamed. So this is a joint over here, this is a joint over here, this is a joint over here. There are joints in our wrist, knees is a joint, shoulder is a joint. Our clavicles, actually, where they meet the other bone, that's a joint. We have joints right on our sternum. We don't have any joint in the rib area or the long bones like these or these. But a lot of patients don't understand what is arthritis or what is really a joint disease. So first you have to, understand in medical school and stuff, like we do anatomy and stuff. So arthritis is basically any space between the two bones that's inflamed. That's the definition for the word.
Excellent, exactly. And I love that you kind of gave several examples, because just like you said, there can be some confusion about what a joint is. I've had patients think that they have arthritis in the long bone, right, in their arm, because there's swelling or some pain there. But as you just described, it is in the joint. So anywhere where you can kind of hinge and move or bend, you have a joint there. If there's inflammation in there, then we call that arthritis. Now, within the big umbrella of arthritis, as you know, there are many different kinds of arthritis. So some people, when they refer to arthritis, they are talking about rheumatoid arthritis or osteoarthritis. There's so many different kinds of arthritis. I named two major types, but walk us through a general overview of the different kinds of arthritis. I know we probably can't go into all of them, but give us the big three maybe that you see in your office and what the difference is between them.
So Aalia, the best way to, I think, describe it is inflammatory versus non-inflammatory. This is more of a medical word to say inflammatory, but for general population to understand is the arthritis causing any swelling of the joint, or is the arthritis causing any stiffness of the joint, especially worse in the morning, which is more classified as inflammatory. The other one is non-inflammatory, where the joint still hurts, but you don't see a swelling. You don't see any redness, and you don't get stiff in it, but it hurts. They're both arthritis, but one is inflammatory and one is non-inflammatory. Now, under the inflammatory category, there are different kinds, different etiologies. Some of them are like what we commonly know are rheumatoid arthritis. Then there is spondyloarthritis, which is a big term which not many people are familiar with, and they don't necessarily need to be. But under that big umbrella, there comes psoriatic arthritis, arthritis due to certain stomach diseases like inflammatory bowel disease or IBD or Crohn's related arthritis. Then some people get exposed to certain bugs and they get arthritis after that ends up being lifelong. So reactive arthritis. And there's another kind of arthritis due to crystals in our joints. And when I say crystal, I actually mean crystal, like a needle. So those are like gout. Typically men have it. I mean, they all can have a separate show on them, but I'll just briefly tell you that these are all these categories like rheumatoid, psoriatic, ankylosing spondylitis, gout. So multiple different kinds of inflammatory diseases. And then there's the other kind, which is non-inflammatory, which is mostly associated with aging, like a machine. We wear and tear, we rub our knees, we walk, we run, we do whatever. We are construction workers, we have people who just lift heavy boxes or whatever. And then those joints are just worn out. So that's the osteoarthritis, which is painful and can also give swelling. There is pain and swelling with osteoarthritis, but typically you don't have inflammation like you would have with others. If you have a painful swollen knee because of it being just worn out, if your doctor takes fluid out of it and checks it under, with the lab and stuff, then you find out it's not because of that. One category that I didn't touch upon is the infectious arthritis, but that is usually, it's a whole different world. And as rheumatologists, we don't get to see it too much. It's usually our orthopedic colleagues that would get to take care of that. But yes, that's another inflammatory category.
Excellent.
But osteoarthritis, as we were talking about, is the one where you are going to have similar pain because patient is going to describe, I have pain in my knee. It's not their job to figure out why it's there, and they're not supposed to know it. So it's us on the back end there where we take appropriate history, do the physical exam, and sort of connect the pieces and either refer to a specialist in case of primary cares, or the specialist then takes further testing, further x-rays, MRIs and stuff to decide what do I think is going on there.
Excellent. So many different categories. Each one has specific signs and features. And as you mentioned, if you're experiencing joint pain, definitely take it to your doctor because there needs to be a little bit of a workup to determine what kind of arthritis you have, and then from there, management and treatment. So for today's episode, we're going to focus on osteoarthritis. And so when we talk about osteoarthritis, let's focus in a little bit more on what you were saying earlier. And start by talking about what are some of the typical signs and symptoms that we see with osteoarthritis, and with osteo, that root word coming from bone, right? So we're talking about, so if just throwing that out there for people when they think about that compared with the other types of arthritis.
So actually you did great. Osteo means bone, arthritis means inflammation. So when those joints that we described earlier, so when those are worn out, like the covering that is on top of the bone is lost due to the overuse or just aging in general, when that happens, that is defined as osteoarthritis. Now, number one joint that gets used is the joint, your CMC joint, which is right here. It's right here in the hand, the first joint, because, we use our hands for everything. The most common one otherwise, knees, shoulders, back. It can technically happen to any joint depending on, your history and stuff, but most commonly we see it in the hands and also in the knees.
Yes, and you mentioned the words wear and tear. That's something I use often with my patients as well when they ask why they have this. And something that I want to point out that I'm sure you've seen, and particularly because I've branched into seeing more patients who have obesity, is that it's not necessarily that we see this anymore only with age, right? So wear and tear, you're thinking age-wise, like the longer you live, the more you use those joints, then you're causing the wear and tear. But I think we're seeing that more often now, even in younger people, because we have obesity on the rise.
Right, correct.
And so that weight is putting excess strain and stress on our joints, as you mentioned, our knees, our back, right? You've got your back. Those are two very big parts of our body that help to support us as we're standing and walking, etc. So they're going to feel this strain of excess weight for sure.
Yes, you're absolutely right. I often describe it to my patients as imagine that you're carrying backpacks, right? So if you have a backpack in the front and a backpack in the back, and I tell you to walk, even if any person would actually start hurting in their knees. Mm-hmm. So you, by being overweight, you're carrying this extra backpack that you're just walking with every day in and out, and eventually your knees are going to give out. The same bone that's supposed to stay apart will start moving closer to each other. And the cartilage that's supposed to last you a long period of time will wear out quickly. Mm-hmm. There's genetic factors associated with that too. If you have family history of early knee disease or early knee osteoarthritis, as we say it, then you're probably at more risk. And on top of that, if you have obesity or a lifestyle of, you've been a construction worker or a similar pattern, using your body too much, then you're at more risk of developing it sooner than later. But one thing that I would like to mention is that it is, I often see it that I get patients referred who are in their 40s and they're thin, lean, and they have knee pain, or for that matter, I've seen patients who have knees that are replaced. So it is unlikely for a person who's not obese, who doesn't have a very active lifestyle, to have a joint that's that bad. Just, like a homemaker or somebody who does a desk job, they shouldn't get it. So that's where you really should consider involving a rheumatologist or a specialist to figure out why did that person develop that disease so early, because that's when you want to rule out other inflammatory diseases, which we discussed earlier. So osteoarthritis is certainly there, and there are a lot of reasons, but if you can't identify that in your history, then I will highly recommend that rather than just sitting with it, you get it evaluated, because now we have more and more data that inflammatory arthritis needs to be treated early to prevent further damage to the bone and to limit the destruction of the joint, and hence, prevent deformity.
That's a great point. I love that you threw that out there, because as you said, we have our typical scenario, what we expect. And when we see an atypical case or in somebody we don't expect those symptoms from, it's really important to be wary of maybe some other things that might be going on that is underlying or behind that inflammation that you're seeing. So I love that you shared that. Now, you talked about evaluation. What does that evaluation look like when a patient comes to you with joint pain and you suspect osteoarthritis?
So when you come to a rheumatologist, any rheumatologist is trained to rule out and consider everything in their differential diagnosis. Even if I have a 60-year-old obese lady with a knee swelling, although I'm thinking in my mind it's most likely going to be knee osteoarthritis, but I will definitely do all the workup to rule out any inflammatory process, because we have seen it over and over again that a lot of times it's missed. They just ignore the pain since it's going on since their 40s or early years. And now it's to the point where they say, oh, we can't walk. And they have hand pain, they have shoulder pain, but it's not severe, so they don't mention it, right? And they don't know that they have to mention. And even when the doctor asks, they don't think that it's worthy to be mentioned. Oh, it's mild pain, I take a Tylenol and I'm better. Oh, but I don't need to mention it. So first, and then, if on your exam, if you don't find any other finding and it's just one knee that's inflamed, then I would still do the same inflammatory workup. I'll run testing for rheumatoid arthritis. I'll run testing for inflammation. I'll still do x-rays and sort of take it from there.
Okay, great. So it sounds like you're taking a comprehensive approach. You're listening to the history. You're doing the examination, all the things that we know are really important when a patient comes in with any complaint. But then at level, as you said, with blood work and imaging to get that workup started to figure out where the cause of this inflammation is from. Excellent. We are going to continue this conversation in just a few minutes. Dr. Yousaf and I will be back after this short break. Stay tuned.
There are 16 million children struggling with hunger in America. That's 1 in 5 daughters, sons, neighbors, and classmates who don't know where their next meal is coming from. Yet billions of pounds of good food go to waste every year. It's time we do something about it. Feeding America is a nationwide network of food banks that helps provide meals to millions of kids and families in need. Visit feedingamerica.org to help them feed even more. Together, we can solve hunger. Together, we're feeding America.
When times get dark, we can't see the help that's all around us. Let 211 be your guiding light for help with food, healthcare, and other resources.
211, how can I help you?
Call 211 or visit 211.org. 211, get connected, get help.
Right here, baby. Look. Uma.
¡Feliz cumpleaños! ¿Cuántos años tienes?
No.
Something more than a birthday is happening here. Once you can see it, you can help. The sooner you recognize the signs of autism, the sooner you can make a lifetime of difference for your child. Start by answering a few simple questions at screenforautism.org.
Dad, they took over my bedroom. Come on, come on. Okay, Dad. 1, 2, 3. Dad! You saved me. Dad?
Are you okay?
I'm fine, dear.
Your hero needs you now, and AARP is here to help. Find the care guides you need at aarp.org/caregiving.
I am what hunger looks like in America. I am an 8-year-old girl who's not excited for the last day of school. Because this may be the last time I'll have lunch.
Till September.
I am a single father of 2 who works 3 part-time jobs, and that's still not enough to put food on the table. I was created by artificial intelligence from faces of the 1 in 8 Americans who struggle with hunger.
Feeding America, 200 food banks strong.
Assalamu alaikum and welcome back to What's Up Doc. I'm your host, Dr. Aalia Al-Barwani, and today we are talking about arthritis. Joining us in that discussion is Dr. Wajeeha Yousaf. Great. So before the break, Dr. Yousaf, we were talking about some of the things that you would do if a patient comes in with joint pain and the workup that you would do in order to diagnose or discover if it is truly osteoarthritis or any of the other forms of arthritis that you briefly mentioned earlier in the show. So once you have this diagnosis for osteoarthritis, talk to me about some of the management options and treatment options that you have for patients who you confirm have osteoarthritis.
Let me talk about the basic options first. Oftentimes, we tell our patients to start with just Tylenol over the counter, and it helps initially in the initial stages. Tylenol is a relatively safe medication. Most medical diagnoses do not interact with this medicine, most medications don't interact with this medicine as such. And if it helps, that's great. Like we discussed, if the main risk factor is obesity in the progression of the disease, then we definitely encourage patients to weight loss. Sometimes it is actually, we send them to obesity specialists because if they're unable to lose their weight on their own, then to get those knees to get better, they need intervention. Then there are physical therapy options. There are a lot of websites, a lot of online resources to do at home, but most of the patients are unable to perform them without the appropriate equipment at the house. So we refer them to physical therapy centers. I personally prefer that, at least for the first 6 weeks, and tell them to learn it the right way and then do it at home if they need to. Then intervention-wise, it's different for different joints. Like for the knees, we have injection therapy. We do steroid injections initially, provided they're not terrible diabetics. We have gel injections, multiple kinds that are FDA approved and mostly covered by most insurances. Then we have PRP therapy that's still not sort of FDA approved, and some insurances are still not covering it, but it is optional for patients.
So there's oral medications, there are options for injections as well, and some new things coming down the pike with respect to those kinds of therapies. And then kind of end of the road option would be surgery, or even for some people who have such severe disease, sometimes that's the first option for them if their severity of their disease is extreme, correct?
It is an option, but I typically, like I said, some patients just don't complain till it's really gone.
So when it comes to injections, how long does the relief from an injection such as Synagis or something similar, or something that has like a steroid in it, et cetera, how long does that of a relief do those injections provide? Because that's something that I get asked quite a bit from my patients.
So different injections have different strengths and different set time period for relief. The regular steroid injection that patients get in the clinic in the knees, they are supposed to last 3 months minimum, and they should not be repeated more than every 3 months. Then there is a newer steroid preparation which can last longer. It's a slow release molecule that's injected in the knee, and it lasts a little bit longer. Then there are these gel injections which are meant to last at least 6 months. These are lubricants that oil the knee, and they are supposed to last at least 6 months. And if they don't do more than 4 months, I feel like that's not a great option for the patients.
One question that I would definitely want to make sure we review is, we've talked about management after the fact, but are there things that one can do to help prevent the development of arthritis? Again, we touched on weight being an issue, being something that you can kind of focus if you're having pain in weight-bearing joints that can help to relieve or prevent progression of arthritis. But are there other things, because I'm sure you've seen these ads where they talk about supplements that can help with that. I've heard, we've seen advertisements for fish oil or curcumin, which is the anti-inflammatory core, I guess, in turmeric. So is there anything that for someone who may be prone to arthritis that they can either do or take to prevent developing or the progression of arthritis? I think we've lost Dr. Yousaf, but it sounds like in general, no supplements have been found to help prevent the development of arthritis, but she was telling us about turmeric or curcumin supplements that can help reduce the pain. And she also shared with us the importance of calcium and vitamin D for healthy, strong bones. In conclusion, I think we lost Dr. Yousaf, so we'll just wrap up this episode today. I hope you learned a lot about arthritis with us today, and we thank you for joining us on this episode of What's Up, Doc. You can watch all of our other episodes on our YouTube page at youtube.com/Muslim Network TV and on our website at muslimnetwork.tv. I'm your host, Dr. Aalia Al-Barwani, and I'll see you next time on another episode of What's Up, Doc.